Come close, come close, come close. I have a very important discussion. And today I'm discussing barrier to conception. The reason why most women don't get pregnant. That you don't get pregnant or you don't conceive, it is not by mistake. Most times there is many things that can cause a woman not to conceive or not to get pregnant. The Bible says that my people perish because of lack of knowledge. And that knowledge is what I want to share with you so that we know if you have any of the factors that can affect a woman from getting pregnant. Maybe if you have any of them, you can treat yourself or you can go for diagnosis, or there's some of them that is basically lifestyle changes. When you change your lifestyle, you will get pregnant. Stay with me. Number one factor that can affect a woman from getting pregnancy is age. When a woman is at her prime age, her eggs is very, very healthy. As her age begins to increase, the quality of egg that she produces will decrease. So this can be a factor why you have not conceived. If you are from 35 years and above, the quality of egg you are producing has decreased. So those that are between the age of 18 and to 30 years produce more quality egg than those from 35 years and above. So if you are producing a low quality egg, you have to engage yourself in hormonal medications that will help boost your egg quality, and this will help you to conceive. Number two factor is lifestyle. Too much stress is not good for women because stress can change their hormones. Stress produces a hormone called cortisol, and this hormone can suppress fertility hormones like estrogen, progesterone, follicle stimulating hormone, luteinizing hormones, and others. This hormone can suppress fertility hormone, and it could be the reason why you're having irregular menstruation, or you are not seeing your ovulation as you're supposed to see, or you are not seeing your menstruation as you're supposed to see. So it could be caused by stress. Too much stress is not good for a woman of childbearing age. So change your stress level. It could help you to conceive. Number three factor is what is called PCOS, polycystic ovary syndrome. If a lady has polycystic syndrome, she will be producing immature eggs. This will affect her getting pregnant. Ladies that has PCOS develop hairs around their mustache, a very big boot, and this is a symptom of PCOS. Some of them has achings, they have skin rashes. Most of them experience these symptoms. You can conceive if the necessary precautions are being put in place, and one of them is that you are going to be placed on hormonal medications that will help you to conceive. That someone has PCOS doesn't mean that the person cannot conceive, but you just need some hormonal medications that will help you to conceive. It will help those your eggs to be mature so that you can get pregnant. So some ladies that have PCOS does not see their ovulation. They don't know what is called ovulation. Number four factor is uterine issues. Basically, this is caused by fibroids. If you have a fibroid, it could also prevent you from getting pregnant. Some fibroids is situated inside the womb, and this can prevent you from getting pregnant. The only way out is to remove the fibroid from the womb and you can conceive. It is so simple. Don't be afraid of going for fibroid operations. It's just so simple. Number five is low sperm count. This is for men. Low quality sperm can hinder a woman from getting pregnant. The problem can be from the motility. It could be from the shape of the sperm. Sometimes a man will have a normal sperm count, but the shape of the sperm cell is not normal. It is very important that you check yourself. Know your sperm count, know the motility, make sure that it is efficient, and also you are producing a quality and healthy sperm cell. That is why diagnosis is very important. You have to check yourself before you blame your wife to make sure that the problem is not coming from you. Number 6 is sexually transmitted infections. This can also hinder you from conceiving, both the man and the woman. It can block fallopian tube. It can cause low sperm count. If you have any sexually transmitted infection, it is very important that you treat yourself. Some sexually transmitted infections causes the pelvic inflammatory disease in the woman's body, and this makes it difficult for the sperm cell to reach the egg inside the womb. It is very important that you treat yourself and treat your wife and make sure they are free from any kind of sexually transmitted infection for conception to take place. The last factor is hormonal imbalance. It is applicable to a man, it is also applicable to a woman. You have to check your hormone level because basically everything about conception, getting pregnant, is done by hormone. When you are facing difficulty in getting pregnancy, you have to go for hormonal profile. This will give you overview of your hormone levels. If your hormone levels are okay, then you can think about other problems, because most of the major problem is hormone issues. It is very important that you check your hormone level whenever you are finding it difficult to get pregnant. Check your hormone level. Is your hormone level okay? If it's not okay, then you take some hormonal medications that will help to boost your hormone level. Also, men can also have hormonal imbalance. Low testosterone can produce low quality sperm. A man needs to have enough testosterone in order to produce a quality sperm cell and also a very viable sperm cell that can fertilize egg. When you are facing difficulty in getting pregnant, these are the things you are going to check. Which one do you have? If you have any of these, then you have to start now. Treat yourself. If it requires going for diagnosis, then go for diagnosis. See your doctor. If you require seeing your doctor, go and see your doctor. All this I have listed out for you. Look at each of them. Know the one you have, the one you don't have, and then you follow the process. But at the end, you are going to get pregnant.